The Director of our Emergency Management. Stephanie Williams is with me, our Chief of Staff at the Arkansas Department of Health, because Dr. Nate Smith is returning from Washington. Dr. Greg Bledsoe, our Surgeon General. Thank you all for your leadership on our health and response team here in Arkansas. Earlier this morning, I received a briefing from my health and emergency management officials, and the important information that I want to convey to Arkansans is that we have no confirmed cases of the coronavirus known as COVID-19 here in Arkansas. We have no confirmed cases here in Arkansas, but we are all taking this very seriously, and it is during this time that we are engaging in planning, contingency planning, education, and responding to inquiries from health officials and other interested people or concerned citizens across the state. So we are taking this very seriously and understand that this is a risk of this global pandemic reaching Arkansas. I did just get off the phone with Vice President Mike Pence, and during that conversation with him, he noted that the risk of infection for the coronavirus remains low. He also emphasized the numbers should be a part of the story, that there are 60 confirmed cases in the United States of COVID-19. Whenever you look at 60 in relation to the United States of America, it is indeed a small number. It is also important to note that in China, where this all started, the reported cases are declining, and so that is some good news for it as well. In Arkansas, as I mentioned, there's no confirmed cases, but there was one person who met the CDC guidelines for testing. This test was sent to CDC headquarters in Atlanta. The test results came back negative. Today, we have identified one additional person who meets the criteria for testing, and we are coordinating that testing with the Center for Disease Control. In addition, here in Arkansas, there are 10 recent travelers that are under home monitoring with daily check-in with the Department of Health and guidance being received from them. These are individuals that are not symptomatic, but they have traveled in a way that meets the CDC guidelines for monitoring. The Health Department is the lead agency in this state response. Dr. Nate Smith is leading this effort, and we're fortunate that he's not only the Secretary of our Department of Health, but he is also President of the national health organizations across the country. And so he's in a key position. He met with the President and the cabinet officials earlier this week while he was in Washington. And I have directed that the Department of Health set up their incident command system. That is operational, it is activated, and I receive daily reports and immediate reports of any particular concerns from the Incident Command Center of the Department of Health. The Department of Health has the necessary statutory authority to isolate and quarantine for any patient who tests positive, and they will take that action as needed. Adam, our emergency management under Director A.J. Gary, is prepared to activate the Emergency Operations Center as needed, but it is not brought up to operation at this point. The citizens should take note of a couple things. First of all, they should take precautions just like they would in terms of a flu concern. They should, because COVID-19 is spread like the flu. So wash your hands, use hand sanitizer, and don't go to work if you are sick. Very common sense approach to this, and that's what we're asking Arkansans to do, is to approach this in a wise manner, a common sense way, and just like you want to avoid the flu, you want to avoid COVID-19 in the same way. We also want to make sure that the people of Arkansas do not overreact. We go about our business, we spend our money, we drive the economy, and we conduct businesses because there's no confirmed cases in Arkansas, and it's important that we go about our daily lives without fear. 2 points that I conveyed to the White House and to Vice President Pence that need to be addressed at the national level. And one is we need to make sure that we have the ability for state-level testing to know whether somebody who is under surveillance, who has been tested, tests positive or negative for COVID-19. Right now, we have to send that to the CDC in Atlanta. We have to wait for those results. And as we continue to monitor this, we need to have state-level testing capacity. And I've been informed by our Department of Health that we expect to have that ability next week. We're coordinating that with CDC, but I emphasize how important that is to have our state-level testing and not simply relying upon our federal authorities. Secondly, I conveyed to the Vice President and to the White House that we need to make sure nationally that we have an adequate supply of personal protective equipment, such as protective masks. They're not needed now, but if we do have confirmed cases in the future, if we have additional that are under observations, then there's going to be a growing need for that protective equipment. And the Vice President assured me that they're looking at ways to accelerate and use emergency authority to accelerate the manufacturing of that supply that will be needed across the country in the future. The critical parts are communication and education. This is a part of our communication efforts. Daily, the Department of Health, through their Incident Command Center, will be communicating to Arkansans as to any reported cases, any facts that they need to know, any new developments in this. The Department of Health has activated their call center. They did that on January 30th, and that way epidemiologists can answer questions from health officials across the state. The number is 1-800-803-7447. And so that is primarily for public health officials, but we might comment more from the Department of Health as to who should access that line. We have received 62 calls that have been handled, providing information to healthcare providers across the state since that call line was activated. In addition, I see a number of our cabinet officials here. I've directed my cabinet officials to develop contingency plans. For example, the Department of Human Services have to get out a lot of work that individuals depend upon across the state, whether it's Medicaid or SNAP benefits or Child Protective Services. We have to have a plan to be able to continue that work regardless of what might happen in the future. Secondly, a critical area, of course, is our Department of Education. I've asked our Department of Education to be able to give proper guidance to our school officials as a contingency matter based upon what might happen in the future. So they're developing those contingency matters because whatever happens in the future, we want education to continue in Arkansas. I do have a little bit of experience in dealing with this type of an outbreak. In 2002, I was with the Department of Homeland Security when we had the SARS outbreak that we were very concerned about. We had to monitor the flights coming into the country. And so I have to compare it with that experience, and everything is different. And the coronavirus is different. And with a lot we do not know about it, a lot we're still learning about it. And so I want to assure everybody we take this seriously. We're working hard on this every day, and we'll do what's necessary to protect the Arkansas public. And so with that, I'd like to ask Stephanie Williams to come make comments from the Department of Health standpoint, introduce some of our professionals that are working very hard, and then that will be followed by comments from our Surgeon General. Stephanie.
Thank you, Governor. We do recognize that Arkansans are concerned, and we appreciate this opportunity to talk about the work that's underway to mount our response to the coronavirus. I'd like to introduce Dr. Jennifer Dillahay. As the Governor mentioned, we have instituted our Incident Command structure and response Dr. Dillahay is our Director for Outbreak Response, and she is leading our medical efforts at the department. Also, just to reiterate, as the governor stated, we currently do not have any cases of coronavirus here in our state, and we do consider the risk to the public at this time to be low. We are monitoring travelers, and I want to note that we appreciate the response we've gotten from those individuals. It's not easy to separate yourself from public interaction for a prolonged period of time. We're asking them to be monitored for 2 weeks, and they've done the right thing. They've been compliant with all the requests from our medical experts. Also, just to note, we are in constant communication with the CDC and other federal agencies that are involved in the response. We have a team of 74 health professionals. These are physicians, nurses, epidemiologists, our laboratory analysts, communications team that are on these calls and monitoring the situation. We get briefed at least daily, if not multiple times during the day. So we are engaged at that level. Also with our state partners, we're working with public safety, with our Department of Human Services, with our Department of Education, with local leaders, with our elected officials, with hospitals, local community physicians, EMS, and law enforcement agencies. Everybody is doing what they should do at this point, making sure we have lines of communication open and that we are referring to the plans. We plan, we prepare, and we drill for these types of situations, and so this is the time to put that good planning into action. The other thing that I would mention is that now is the time, as the governor said, for everybody else to engage with us and plan and prepare. So we are asking you to first join us by logging onto our website and become familiar with that site. It is healthy.arkansas.gov. At that site, that's where you're going to find the status of our situation here in Arkansas. It also links you to the CDC so you can get the national perspective. Also on that site, it will have guidance for particular groups. For employers, there's a special guidance. For schools, there is a guidance. For travel, there is a guidance that's updated all the time. So it's a really great source of information. The other thing is there are lots of rumors. This always happens when we have these situations. So please go to the website. You will get information there. When we hear rumors at the department, we investigate those. We reach out to health professionals and hospitals to see if we can verify if there's a concern. If there is a legitimate concern, that will be reported on our website. So please utilize that site as your source of primary information. Also, the phone number that was mentioned, it is posted on our website. I would ask that you please read the information that's available on the website first before you call, just so we can make sure that we keep those phone lines open for our healthcare professionals and others that may have an issue other than just an informational need. And I believe that will conclude my remarks. And Dr. Bledsoe?
Thanks, Governor, and thanks, Stephanie. I just have a couple of comments to make. First thing I'd like to say is please remember that 80% of the cases of people that have coronavirus are mild cases. So the majority of people who are getting this illness are having very mild symptoms. The ones that are making the news, obviously, are the severe cases, but the vast majority of people who are getting this coronavirus are having very mild symptoms. And then also, to echo what Stephanie said, every family, every community should have a preparedness plan, and this is just a great opportunity to go through your preparedness plan as a family and think to yourself, you know, what would we do in a situation if we couldn't get to the store or whatever? Not in a panicked way, not in something that's emergent today, but just be thinking about that. So the way I've been telling my friends and family is that if you knew that there was the potential that there was a snowstorm or an ice storm or something coming in the next few weeks, what would you do? How would you prepare for that? So just going through that as a family and as a community and thinking about those things so that every family has a plan in case there is some disruption because of the spread of the disease. And then lastly, just knowing this, that this is an evolving situation. This is something that we're watching. We're watching these other countries. We're watching California. We're watching other states. And as the situation continues to evolve, there is a chance that the number of cases could increase. But please remember that if this happens, we're watching this and we're learning and we're getting smarter. So on the federal level, on the state level, and internationally, we have experts who are looking at this and the spread of this disease, and every day we're learning every day we're getting better, and there are companies and groups that are looking to provide the development of vaccines and therapeutics for this. And we're learning from the data that's coming out of other countries and areas about what specifically is going on in these patients and what makes the coronavirus that we're seeing unique. And so as these days unfold, we're getting stronger, we're getting better, and we're getting better prepared to adjust no matter what happens in the future. So with that, I'll conclude my comments, turn it back over to the governor.
And I do want to thank Secretary Cook, who has met with many of our cabinet officials and convened our Homeland Security working group to make sure that we have the contingency plans that are very important for us. With that, we'll take any questions.
Governor, give your background in federal government. What do you think of the Trump administration's response has been so far on this, in particular President Trump? It seems they've had some inconsistent messaging on it.
Well, the first thing you have to note is that the administration has been very aggressive in making sure that we respond quickly, and for that reason, the commercial travel was stopped, and that helped reduce and contain it away from the United States of America. So that step alone was probably the most significant step that could be taken, and it was an aggressive action. You actually contrast that to the SARS of 2002, we did not stop commercial travel. We monitored, so it was a more aggressive action than we had in 2002. The fact that he has appointed the vice president indicates the seriousness in which they're taking it. In terms of the public communication, the CDC, HHS, they have done a good job of communicating the concerns of the American public. And so I applaud the administration for its aggressive approach to this. Yes?
Dr. Bledsoe, for you, the American College of Emergency Physicians sent a letter to Congress this week saying additional resources were needed, particularly in emergency rooms. Have you seen that? You work in an emergency room situation, and what are those resources that would be needed?
That's a great question. I think our emergency departments across the country are always in need of extra resources. They're pushed to the limit already. Whenever you start looking at a potential influx of patients, like for instance when you have a bad flu season, it always causes some problems in the emergency department. And I think the purpose of the letter is just to say that if this begins to increase in case volume, that we're going to need the potential to have other staff available, other resources like making sure that we have protective gear like masks and those sort of things. I think it's a good thing that the American College of Emergency Physicians addressed the issue, and I feel confident that the federal government's going to respond to that. But you know, the take-home point is our emergency departments are pushed to the max already, and so it's something that definitely needs to be discussed.
Companies have supply chains that are exposed to losses in China and sort of where that is at this moment?
At this point, the economic impact on Arkansas is very minimal. Primarily, the hit it comes with the impact on the stock market. But in terms of our economy, in terms of the consumer confidence, in terms of our business activity, it remains very strong. There will be a national impact from this. You're already seeing it. Anytime there is a national economic impact, that impacts us here in Arkansas. So it is a concern to us in the future. The important thing is that we do everything we can to contain it, to diminish its impact, and to give the public confidence in what we are doing to plan, prepare for it, and to get over this difficulty. And consumer confidence is an important part of it. And so Arkansans need to continue to do business, operate their business, to spend money, and that's how you keep the economy moving.
What should Arkansans do in terms of traveling within the country and outside the country? Like, should people try to limit their travels to other areas?
They need to look at State Department guidance on that for what region they're traveling to. But obviously, the travel to Asia has been either stopped or curtailed dramatically. That does have a challenge for us with some of our international companies globally who's doing business in Asia. I know that yesterday we had a group of students from Harding University that returned from Italy in their study abroad, and they coordinated their return with the Department of Health. And so what you see is travelers naturally being careful, making good judgments as to where they travel, and getting good guidance from the State Department as to the level of safety.
Governor, someone characterized the administration, White House's response over the past week as scrambling. How much of a scramble have you guys gone through the past week as this has come?
Well, we haven't scrambled. We have worked hard. And scrambling implies activity without necessary focus and preparation. That's not been our team. So we have been ahead of the curve, and we have the opportunity to be ahead of the curve here in Arkansas. Great health team, national leaders in infectious diseases that's on our team. So we've been methodically working through our contingency plans, as well as already putting up our incident command center, responding to and getting information out. I've been engaged in this from day one, whether it is involved with voluntary quarantine over a suspected traveler that meets the CDC guidelines. All of those decisions have been thoughtfully proceeded, but the important thing is the contingency plans. This is the first time that I've had a communication to the public directly, and while we've been working very hard on it, it's important for Arkansans to know we've been working very hard on it. In terms of the administration, this should not be politicized, first of all. This is something that everybody works on together to solve because we're impacted by it, whether it's economically or health-wise. There was a debate on how much money the federal government should put forth. I like Senator Blunt's comments from Missouri, a friend of mine, and he said in normal times you would agree upon putting forth the original amount of, $5 billion, and then in 30 days you'd evaluate it and come back to Congress if you needed more and be granted. And now they're trying to front load it with some figure that nobody really knows exactly what is needed. So you get the money out there, and I have full confidence that Congress will fund whatever is needed in the future. So let's leave politics out of it, and this is something that I know the President, the Vice President will be focused on. The Vice President said he just talked to Governor Newsom of California and Governor Cuomo of New York. That's what I call working in a bipartisan way to address this national challenge.
Governor, this obviously comes right along with flu season, and we saw all of the school closings just as a result of the flu. Have we learned anything from there was quite a few district-wide closings already this year. Have we learned anything from those closings that might help us be better prepared for coronavirus?
Well, it's a good contrast, first of all, that I believe we've had 60 deaths this flu season from the flu. And so we always go through these challenges, as you pointed out, schools being closed. What do we learn from that is education and to make sure that we're taking the proper steps and sanitizing our hands and taking the normal precautions to avoid infecting someone else. We also learned that parents are very protective of children, and parents are not going to send their children to school if there's a risk of the normal flu, and obviously they're not going to send them to school if there's a risk of contracting the coronavirus. And so what you learn from that is you got to have contingency plans so that education continues. Hopefully we will not have that type of statewide concern. We won't have, hopefully, confirmed cases, but if we do, we recognize that will be an impact on education. In Japan, they've closed schools through the end of March. In Hong Kong, they've closed schools through past Easter. And so these are repercussions on education that we're not facing in Arkansas, but we want education to continue regardless of the circumstances. We are certainly looking as to what we need to do as a contingency plan. Thank you all very much. They'll be available if there's additional questions. Appreciate your attention today.
Thank you, Governor.
I do okay.
You did an excellent job. No, sir, you did not. Thank you so much.
I got a little bush in there. Sometimes mispronounce words.
No, you did it. It was perfect. Thank you.
Thank you.